Yaman from BSN 212E Group 19 of Davao Doctors College. And for today's video, I will be showing you my written demonstration on basic life support with the application of cardiopulmonary resuscitation. BLS is a set of emergency procedures that consists of recognizing respiratory or cardiac arrest and the proper application of cardiopulmonary resuscitation with or without automated external defibrillation or foreign body airway obstruction management and rescue breathing or to maintain life until a victim recovers or advanced life support is available. So cardiopulmonary resuscitation is a series of assessment and interventions using techniques and maneuvers made to bring victims of cardiac and respiratory arrest back to life. So there are different ways on how to do a BLS on a newborn, infant or child, and adult. And then now I am going to perform this on a newborn. So before anything else, as responders, we need to generally assume that all victims have infectious diseases. That's why we should always observe safety protocols at all times. So now I will be wearing my working gloves. Now, for the first step, we need to evaluate newborn's transition to extrauterine life using Apgar score. Apgar score is a quick test done after a minute or 5 minutes after birth. The 1-minute test will tell us how well the baby tolerated the birthing process, and the 5 minutes will tell us how well the baby is doing outside the womb of the mothers. So in this demo, let us assume that the baby has an Apgar score of 3, which is considered as critically low, meaning we need to immediately resuscitate the baby. So, after determining the Apgar score, we need to check for the responsiveness of the baby by tapping the shoulder, rubbing the soles of the feet, and calling out the name loudly. Baby, baby, are you okay? Baby, baby, are you okay? So, if there's no response, position the newborn on his back and call for help to activate code blue or the doctor's quick so that the doctor and nurses could come over and help in reviving the baby. So if necessary, open the airways and suction. So suctioning the baby's mouth and nose using a suction bulb will remove secretions that is obstructing the baby's airway. We can tilt the head and lift the chin of the baby to open airways. And now I am going to suction the baby's mouth first, and then the nose. So if baby is still apneic and brachycardic, we need to perform the positive pressure ventilation or PPV using Pediatric bug valve mask or the PVM, a non-invasive type of PPV. So as you can see, I have attached my BVM to an oxygen cylinder with 100% oxygen, and then now I am going to cover the baby's mouth and nose with BVM. So allow 30 seconds of ventilation or 40 to 60 breaths per minute, and then check for the chest rise with each bagging. So this will increase the survival rate of the baby. So we need to place the thumb and forefinger at the rim of the mask, and the others will be in the jawline to make sure that it's not touching the eye. Or choking the baby, and also supporting the head. So, assuming that we are done the 30 seconds, now have someone attach the cardiac monitor and pulse oximeter. Hey nurse, please attach the cardiac monitor and pulse oximeter to the baby. Thank you. So this is to measure the baby's oxygenation, heart rhythm, and baby's condition and still needs resuscitation. Now, if heart rate is still less than 60, after that, give the baby gentle chest compressions. So, use either 2 to 3 fingers or the 2-thumb technique when doing compressions. So, as for me, I am going to use the 2-finger technique, and I am going to place my compression fingers at the center of the chest below the nipple, and then give 30 chest compression within 18 seconds or less, and it should be approximately 1/3 or about 1.5 inches the depth of the chest. It is to reach the heart while minimizing the fractures and assure for the chest recoil. So now I am giving 30 chest compressions. Now giving 30 chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. So, give 2 rescue breaths using the mask in less than 10 seconds. Giving 2 rescue breaths. 1, 2. So, after 4 cycles and the baby's heart rate is still less than 60, switch roles with another rescuer, continue chest compressions, and assist in intubation and giving meds. So, assuming that I am the second rescuer, so giving 30 chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. So now I am going to give 2 rescue breaths to the baby. Giving 2 rescue breaths. 1, 2. So after 10 minutes, if baby's heart rate is still unpredictable, discontinue resuscitation. So during the 5th set of compressions, roles are switched to the second rescuer, who will be giving 15 chest compressions within 9 seconds, and the first rescuer will be giving 2 rescue breaths. So assuming that I am the second rescuer who will be giving 15 chest compressions. So giving 15 chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So assuming that I am the first rescuer who will be giving 2 rescue breaths. Okay, giving 2 rescue breaths. 1, 2. Now, after 2 cycles, 2 restorations, rescuers will switch roles again. First rescuer will be giving 15 chest compressions within 9 seconds, and the second will be giving 2 rescue breaths. So, I am the first rescuer, so, giving 15 chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So, assuming that I am the second rescuer who will be giving 2 rescue breaths. Giving 2 rescue breaths. 1, 2. So, if heart rate is greater than 100, discontinue resuscitation and do post-resuscitative care. Post-resuscitative care includes monitoring vital signs such as the blood pressure and oxygen saturation, do airway and ventilation management, temperature management, and put baby in a recovery position like this. So, while holding the baby for about 30 to 60 seconds. So, assuming that the 30 to 60 seconds are done, now we have to put the baby again. And then lastly, document the time, procedure, assessment, and responses to treatment and medication given. And that's all for the newborn resuscitation, and now we are going to proceed to the pediatric resuscitation. Thank you. So now let's proceed to the pediatric resuscitation. First thing to do is to check the environment. Make sure the scene is safe. Up, down, left, right. The scene is safe. Proceed. So let us check for the responsiveness of the child by gently squeezing their shoulder and calling them out. Hey, hey, are you okay? Hey, hey, are you okay? So if there's no response, ask for someone to call for an emergency and attend back the patient right away. So, you sir, please call 911 and bring an AED. There is a patient needing our help. And after that, attend back to the patient and open their airways and check for breathing up to 10 seconds using the look, listen, and feel method. Look for the chest rise and fall. Listen for breath sounds and feel for respiration of air. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So assuming that the patient is not breathing, give 2 rescue breaths, 1 or 1.5 seconds each. So I'll be getting my mask, cover the nose and mouth with it, and deliver 2 rescue breaths. So delivering 2 rescue breaths. 1, 2. So after that, check victim's sign for circulation. Pulse not found. If no signs of circulation found, proceed to CPR. For an infant, find the correct position to compression by using the 2 to 3 fingers or 2 thumb technique, and compress the chest quickly and rhythmically. So give 30 chest compression within 18 seconds or less than. It should be approximately 1 to 3 or about 1.5 inches the depth of the chest to reach the heart while minimizing the rib fractures and assure for chest recoil. Now giving 30 chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. So giving 2 rescue breaths. 1, 2. Give 5 cycles of chest compressions and 2 rescue breaths per cycle. Stop when the rescue or help arrives. Now, if the patient is a child, puts one hand in correct position for chest compressions. So, place the heel of your one hand at the lower half of your breastbone and give 30 chest compression at 1 and 1/2 inches deep of the chest. And then continues 5 cycles of compressions and give 2 rescue breaths per cycle. So, giving 30 breast compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Giving 2 breaths rescue. 1, 2. So after 1 minute of CPR, pulses and check the patient for circulation. Checking the pulse. Pulse found. Pulse found. So if pulse is found, discontinue resuscitation and puts the patient in recovery position, lying on their left side and their arm is supporting their head. So assuming that the patient is already in her recovery position, and after that, document the time the procedure started and the time of recovery. So that's all for the pediatric resuscitation. And now, let's proceed to the adult resuscitation. Thank you. So now, let's proceed to the adult resuscitation and AED skills. So first thing we do is to check the environment. Make sure the scene is safe. Up, down, left, right. The seat is safe, proceed. Now, let us check for the responsiveness of the adult by gently squeezing their shoulder or calling them out. Hey, hey, are you okay? Hey, hey, are you okay? If unresponsive, shout for help. Help! Help! So, check pulse and breathing simultaneously. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. No pulse found. Activates emergency response system and sends for AED. You, sir, please call 911 and bring AED. Someone needs our help. Now, place hands on lower half of sternum and give 30 compression in no less than 15 and no more than 18 seconds. Compress at least 2 inches and complete recoil after each compression. So, giving 30 chest compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. So check for any airway if there's an obstruction. Okay, no obstruction found. And then give 2 breaths with a barrier device. Giving 2 rescue breaths. 1, 2. So each breath is given over 1 second. Visible chest rise with each breath. So after that, resume compression in less than 10 seconds until response arrive to take over. And then chest compressions could be very exhausting. Compressions, the more we give chest compressions, the less deep and less effective it could be. That's why we need to call for bystanders that can be easily taught. Now, after the adult resuscitation, let's perform the AED skills. AED analyzes heart rhythm and, if necessary, administer an electric shock or defibrillation to help the heart reestablish an effective rhythm. And assuming that I am the second responder, I will be turning on the AED and check for the patient's chest. If it is hairy, quickly trim it because we are going to attach the pads in there, and hair might serve as the barrier and AED might not deliver the greatest shock. Now I am going to attach the pads. First pad will be on the upper area of the chest, just below the clavicle. And then the second will be placed beneath the patient's armpit, just below the nipple. Now, clear for analysis. AED will start analyzing the heart rhythm and might tell us to stop doing the compressions and rescue breaths. And then let's assume that the AED tells us to stop. After, it will create a safety deliver shock, so it might tell us to stay away from the patient because it will deliver a shock. Everybody move. Area clear now, safe to deliver shock. So safety delivers a shock. Shock delivered. So after AED will tell us to resume 30 chest compressions and rescue breaths for how many cycles. And after that, it will analyze again the heart rhythm, and if necessary, would still deliver shock. So there must be a switch roll every 2 minutes or after every 5 cycles. So now, I switch to the second rescuer, who will be giving 15 chest compressions within 9 seconds, and the first rescuer will be giving 2 rescue breaths. So, giving 15 chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So giving 2 rescue breaths. 1, 2. So now, after 2 minutes, rescuers will switch roles again. With the first rescuer will be giving 15 chest compression within 9 seconds, and the second rescuer will be giving the 2 rescue breaths. So assuming that I am the first rescuer, so giving 15 chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So assuming that I am the second rescuer, giving 2 rescue breaths. 1, 2. So it is important to practice good team dynamics. So continue doing that until AED tells us to stop. So after everything, document the time procedure started at the time of recovery. So that's all for the adult resuscitation, and for my basic life support from newborn, infant or child, and adult resuscitation and AED skills. Thank you.